Many people believe that kidney stones are nothing more than a common cause of back pain that will eventually go away on its own. Others think kidney stones only affect people who don't drink enough water. Some even assume that as long as they can still urinate, their kidneys must be healthy, but the reality is far more complex. Kidney stones can develop silently for months or even years without causing any noticeable symptoms. When symptoms finally appear, the pain is often so intense that it can leave a person unable to stand, walk, or find a comfortable position. Even more concerning, if a stone blocks the urinary tract and is accompanied by an infection, it can become a medical emergency that requires immediate treatment. That's why recognizing the early warning signs is far better than waiting for severe pain to strike without warning. Your kidneys work around the clock, filtering waste, balancing fluids and minerals, regulating blood pressure, and supporting red blood cell production. Most people rarely think about them until something goes wrong. Kidney stones develop when minerals in the urine crystallize and gradually grow into hard deposits. This process often occurs silently, so many people don't realize they have kidney stones until a stone moves or blocks the urinary tract, causing severe pain. Kidney stones have become increasingly common worldwide, driven by factors such as poor diet, high sodium intake, inadequate water consumption, obesity, diabetes, and sedentary lifestyles. The good news is that most cases are preventable through healthy daily habits. In this video, you'll learn how kidney stones form, who is most at risk, 8 warning signs that should never be ignored, and 10 simple science-backed habits to help protect your kidneys. Everything discussed is based on recommendations from the NIDDK, the National Kidney Foundation, the American Urological Association, and the European Association of Urology. One warning sign is often mistaken for ordinary muscle pain, even though it may signal a blocked urinary tract. Stay until the end so you don't miss these important symptoms. If you find this video helpful, let us know where you're watching from in the comments. Then like, share, and subscribe for more evidence-based health content. Warning signs of kidney distress. Number 1. Severe pain in the side or lower back. This is the most common symptom of kidney stones. The pain usually starts suddenly on one side of the lower back or flank and is often described as extremely severe. Unlike muscle pain, it comes in waves, doesn't improve with rest, and may spread to the lower abdomen or groin as the stone moves through the ureter. If you experience sudden, intense flank pain, especially if it's accompanied by nausea or doesn't improve, don't assume it's a muscle strain. Seek medical attention promptly to identify the cause and prevent possible complications. Number 2. Blood in the urine. The second warning sign that should never be ignored is blood in the urine. It may appear pink, bright red, brownish like tea, or be detectable only through laboratory testing. This can happen when a kidney stone scrapes the lining of the urinary tract, causing small blood vessels to bleed. Even if the amount of blood is minimal, it requires medical evaluation. Kidney stones aren't the only possible cause. Urinary tract infections, other kidney disorders, and certain urinary tract cancers can produce the same symptom. Never ignore unexplained blood in your urine or wait for it to disappear on its own. Number 3. Fever and chills. If kidney stone symptoms are accompanied by a high fever or chills, treat it as a medical emergency. These symptoms may indicate a urinary tract or kidney infection occurring alongside a blockage caused by the stone. When urine cannot flow normally, bacteria can multiply rapidly and may spread into the bloodstream, leading to sepsis, a life-threatening condition. Warning signs include fever, chills, weakness, a rapid heartbeat, and low blood pressure. Medical treatment should never be delayed. Depending on the situation, doctors may prescribe antibiotics, relieve the blockage, or perform other procedures. Never assume a fever is a normal part of kidney stone pain. Number 4. Difficulty urinating. Another important warning sign is difficulty passing urine. You may feel the urge to urinate but produce only a small amount, a few drops, or no urine at all. This can occur when a kidney stone partially or completely blocks the ureter. The longer the blockage remains, the greater the pressure placed on the kidneys, which may eventually impair kidney function. Even if urine is still passing, a significant decrease in volume combined with severe pain requires prompt medical evaluation. Don't wait for symptoms to worsen or signs of infection to appear. Number 5. Pain or burning during urination. Painful or burning urination is often blamed on a urinary tract infection, but kidney stones can cause the same symptom. As a stone moves closer to the bladder or urethra, it can irritate the surrounding tissues, making urination painful or uncomfortable. Some people also feel as though something is blocking the flow of urine and may need to urinate frequently while passing only small amounts. Because these symptoms closely resemble a urinary tract infection, proper testing is needed to determine the cause. If painful urination occurs together with fever, blood in the urine, or severe flank pain, seek medical care immediately. Number 6. Persistent nausea and vomiting. Severe pain can stimulate the brain's vomiting center through the nervous system, while a urinary blockage may further disrupt the body's fluid and electrolyte balance. Repeated vomiting can quickly lead to dehydration, making the urine more concentrated and potentially worsening the condition. If severe flank pain is accompanied by persistent vomiting, especially if you're unable to eat or drink, seek medical attention without delay. Number 7. Cloudy or foul-smelling urine. Healthy urine is usually clear or pale yellow with only a mild odor. Cloudy urine, or urine with a strong, unpleasant smell, may indicate a urinary tract infection. In people with kidney stones, a blockage allows bacteria to multiply more easily, increasing the risk of infection. If cloudy or foul-smelling urine is accompanied by fever, chills, flank pain, or a general feeling of illness, immediate medical evaluation is essential because the infection can spread to the kidneys or bloodstream if left untreated. Number 8. Worsening pain. The final warning sign is pain that continues to become more severe. It may start as occasional discomfort, but gradually become more frequent or constant as the stone moves or the blockage worsens. If the pain doesn't improve with treatment or is accompanied by fever, vomiting, difficulty urinating, or blood in the urine, seek medical care immediately. Early diagnosis and treatment can help prevent kidney damage and other serious complications. Now that you've learned the 8 emergency warning signs of kidney stones, the next step is understanding the daily habits that can help prevent them and protect your kidneys for years to come. Essential health tips to follow. Number 1. Drink enough water every day. The simplest and one of the most effective ways to prevent kidney stones is to make sure your body gets enough fluids. When you're well hydrated, your urine volume increases, making the minerals in your urine more diluted. This reduces the chances of crystals forming and sticking together to become kidney stones. On the other hand, when your body doesn't get enough fluids, your urine becomes more concentrated, increasing the likelihood of crystal formation. Guidelines from several major health organizations recommend that people at risk of kidney stones produce about 2 to 2.5 liters of urine each day. To achieve this, most people need to drink approximately 2.5 to 3 liters of fluids daily, although individual needs vary depending on physical activity, climate, and overall health. One simple way to monitor your hydration is by paying attention to the color of your urine. Pale yellow urine generally indicates that you're getting enough fluids, while dark yellow urine may be a sign that you need to drink more water. Keep in mind, however, that urine color can also be affected by certain foods, medications, or vitamin supplements, so use it as a general guide rather than your only measure of hydration. Number 2. Reduce your salt intake. Many people associate salt only with high blood pressure. However, consuming too much salt can also increase your risk of developing kidney stones. Why does this happen? The more sodium you consume, the more calcium your kidneys excrete into the urine. Higher levels of calcium in the urine increase the likelihood of forming calcium stones, which are the most common type of kidney stone. Salt doesn't come only from the salt shaker. Instant noodles, potato chips, fast food, canned foods, processed meats, and many bottled sauces often contain surprisingly high amounts of sodium. Making a habit of reading nutrition labels can help you reduce your daily sodium intake. The closer you stay to the recommended sodium intake, the better it is not only for your kidneys, but also for your overall cardiovascular health. Number 3. Avoid excessive animal protein. Protein is an essential part of a healthy diet. However, more isn't always better. Eating excessive amounts of animal protein can increase uric acid production while lowering citrate levels in the urine. Citrate is a naturally occurring substance that helps prevent kidney stones by keeping minerals from crystallizing. This doesn't mean you need to eliminate meat, poultry, fish, or eggs from your diet. Instead, the goal is to consume them in balanced portions that match your body's nutritional needs. If you've had kidney stones before, your doctor or a registered dietitian may recommend a protein intake that's tailored to your individual health condition. Combining animal protein with plant-based protein sources is another effective way to maintain a balanced and kidney-friendly diet. Number 4. Continue getting calcium from food. Many people stop drinking milk or eating dairy products as soon as they learn that their kidney stones contain calcium. In reality, that assumption isn't always correct. Calcium obtained from food actually helps bind oxalate in the intestines, reducing the amount of oxalate that is absorbed into the bloodstream. As a result, less oxalate reaches the urine, lowering the risk of calcium oxalate stone formation. This is why international medical guidelines generally do not recommend restricting dietary calcium for most people with calcium kidney stones unless there is a specific medical reason to do so. What does require caution, however, is taking high-dose calcium supplements without medical supervision. So don't make drastic changes to your diet based solely on general information that may not apply to your individual situation. If you've experienced recurrent kidney stones, talk with your healthcare provider before making significant dietary changes. Number 5. Limit high oxalate foods if you're at risk. Oxalate is a naturally occurring compound found in many plant-based foods. In some people, oxalate can combine with calcium in the urine to form calcium oxalate stones. Foods that are relatively high in oxalate include spinach, beets, almonds, cashews, rhubarb, and dark chocolate. However, it's important to understand that not everyone needs to avoid these foods. For most healthy people, they can still be part of a nutritious and well-balanced diet when eaten in moderation. Limiting oxalate intake is generally recommended only for people with recurrent calcium oxalate stones or those who have specific risk factors. Pairing high oxalate foods with calcium-rich foods during the same meal may also help reduce oxalate absorption in the intestines. Next, we'll cover 5 more healthy habits that are often overlooked but can play a major role in reducing the long-term risk of recurring kidney stones. Number 6. Limit sugary drinks and soft drinks. The next habit to pay attention to is drinking sugary beverages too often. Sugar-sweetened drinks, including soft drinks, sweetened bottled teas, energy drinks, and other beverages with added sugar, have been linked in numerous studies to an increased risk of developing kidney stones. Excessive sugar intake, particularly fructose, can increase the production of uric acid and affect the way your body processes certain minerals. Over time, this may create conditions that make kidney stone formation more likely in some individuals. In addition, cola beverages contain phosphoric acid, which may contribute to the formation of certain types of kidney stones when consumed in excessive amounts. This doesn't mean that every glass of a sugary drink will immediately cause kidney stones. However, drinking these beverages almost every day for many years may increase your risk, especially if you don't drink enough water. Water should always remain your primary source of hydration. If you choose to drink beverages other than water, try to select options that are low in sugar or contain no added sugar, while still making sure you meet your daily fluid needs. Number 7. Maintain a healthy body weight. Being overweight doesn't just increase your risk of diabetes, high blood pressure, and heart disease. Numerous studies have also shown that obesity is associated with a higher risk of kidney stones. Why does this happen? In people who are overweight, metabolic changes can make the urine more acidic and alter the balance of minerals involved in kidney stone formation. In addition, obesity is often associated with insulin resistance and metabolic syndrome, both of which have been linked to an increased risk of kidney stones, particularly uric acid stones. Gradually losing weight through a healthy diet and regular physical activity not only benefits your heart and blood sugar levels, but may also help reduce the risk of recurrent kidney stones. It's important to remember that rapid weight loss or extreme dieting can have negative effects on your body. Instead, choose a safe, realistic, and sustainable approach that you can maintain over the long term. Number 8, stay physically active every day. Healthy Healthy kidneys are supported by a healthy, active body. Regular physical activity helps maintain a healthy weight, improves metabolism, increases insulin sensitivity, and supports overall well-being. You don't have to engage in intense exercise to experience these benefits. Simple activities such as walking, casual cycling, swimming, or light aerobic exercise can make a meaningful difference when performed consistently. For older adults, regular physical activity also helps preserve muscle strength, balance, and maintain overall fitness. The most important thing is to choose activities that match your current health condition and physical abilities. If you have heart disease, joint problems, or other medical conditions, consult your healthcare provider before starting a new exercise program. Remember, the human body is designed to move. The more time you spend sitting without physical activity, the greater your risk of developing metabolic conditions that can eventually affect your kidney health.
Number 9. Don't hold your urine. A habit that many people consider harmless can actually affect the health of the urinary tract. Some people regularly delay urination because they're busy at work, traveling, or simply don't want to use the restroom. Occasionally, holding your urine is unlikely to cause kidney stones directly. However, if it becomes a frequent habit, it may increase the risk of urinary tract problems. When urine remains in the bladder for too long, bacteria have more opportunity to multiply, increasing the risk of urinary tract infections. In certain situations, these infections can contribute to the development of struvite stones, a type of kidney stone associated with specific bacterial infections. Holding your urine for extended periods can also cause discomfort and interfere with the bladder's normal function. For this reason, try to urinate when you feel the urge, especially when restroom facilities are available. This simple habit can help support a healthier urinary tract over the long term. Number 10. Get evaluated if you've had kidney stones before. Many people believe the problem is over once a kidney stone has passed or been successfully treated. In reality, kidney stones have a tendency to recur. Research has shown that without appropriate preventative measures, many people who have had kidney stones may develop them again within the next several years. That's why follow-up evaluation is so important. Your doctor may recommend analyzing any stone that has been passed, performing a 24-hour urine collection in some cases, ordering blood tests, or using imaging studies such as an ultrasound or CT scan to determine what caused the stone to form. This information is extremely valuable in developing the most effective prevention strategy for your specific situation. For example, someone with calcium oxalate stones may require a different prevention plan than someone with uric acid stones or infection-related stones. The more accurately the underlying cause is identified, the more effective the preventative approach can be. Don't wait until another painful episode occurs before taking steps to protect your kidneys. Prevention is almost always easier, less expensive, and far more comfortable than treating a kidney stone after it has caused a blockage or other serious complications.
Kidney stones don't develop overnight. In many cases, they form gradually over the course of months or even years. Because this process happens slowly, there is also an opportunity to prevent kidney stones before they become a serious problem. Recognizing emergency warning signs such as severe flank pain, blood in the urine, fever, difficulty urinating, painful urination, persistent nausea and vomiting, cloudy urine, and pain that continues to worsen can help you seek medical care early before serious complications develop. At the same time, simple daily habits such as staying well hydrated, reducing your salt intake, eating a balanced diet, maintaining a healthy weight, staying physically active, avoiding the habit of holding your urine, and getting proper follow-up if you've had kidney stones before can go a long way toward protecting your kidney health. It's important to remember that not all kidney stones can be prevented in the same way. Every person has different risk factors, medical conditions, and types of kidney stones. That's why, if you've experienced kidney stones in the past, it's important to consult your healthcare provider for personalized advice based on your specific situation. Protecting your kidneys isn't just about avoiding pain. Your kidneys play a vital role in filtering waste from your blood, maintaining your body's fluid and electrolyte balance, regulating blood pressure, and supporting many other essential functions every single day. The better you care for your kidneys today, the greater the chance they'll continue functioning well for many years to come. Thank you for watching this video all the way to the end. If you found this information helpful, let us know in the comments where you're watching from and whether you've ever experienced kidney stones or any urinary tract problems. Your story could inspire a topic for one of our future videos. Don't forget to like, subscribe, and share this video with your family and friends so more people can recognize the warning signs of kidney stones early and learn how to protect their kidney health with evidence-based information. Thanks for watching, and we'll see you in the next health video.